subgroup of patients with aortic stenosis who have unusual pathophysiology. They have a low transvalvular gradient, usually less than 40 millimeters of mercury, have valve areas of less than 1 centimeter squared by calculation, and a reduced stroke volume with a normal ejection fraction, and apparently a poor prognosis. Now in circulation, researchers report on the outcomes of a group of such patients compared to the outcome of patients with more moderate aortic stenosis. Outcome in patients with low gradient, quote, severe, end quote, aortic stenosis was compared with outcome in patients with moderate stenosis measuring an aortic valve area of about 1 to 1.5 centimeters squared and a mean gradient of 25 to 40 millimeters of mercury. During 46 months of follow-up, almost 4 years, there was no difference in outcome between the two groups. Almost half, that is 46%, of the low gradient severe stenosis patients with reduced stroke volume had aortic valve events, but so did 51% of the patients with a normal stroke volume index. The researchers concluded that low gradient, quote-unquote, severe aortic stenosis patients with reduced stroke volume index had aortic valve events comparable to those in patients with moderate aortic stenosis. Well, what does that mean? Well, looking at the numbers, it seems to me that having aortic stenosis is not a good thing regardless. Aortic stenosis is a bad actor. A 50% event rate at 4 years is high, and perhaps we ought to consider repairing aortic stenosis sooner rather than later, especially now that transcatheter valve replacement seems promising. I'm Peter Block with a CardioSource Heart Minute.